Time now for this week's Health Matters. Paul Critz, along with PA Lynn Szabo, our host, and talking. How do you characterize today's? What's this? Your
important healthcare maintenance and the story behind it, because it's actually a fascinating women in science kind of story.
Okay, all right.
So, and what I wanted to talk about was Pap smears. Now, I hope 50% of the listeners, plus or minus, aren't tuning this out, because Pap smears are actually a screen for abnormal cell growth, and you could Pap anything.
You can Pap anything. Okay. So
I could Pap this chair if I wanted
if you need,
to.
Right. Okay.
Yeah. So,
and thank you, because I mean, as a man, as a male, for all of my life, Pap smears are just a mystery to me. I have no idea what they entail.
Well, I've Papped men before, and in the HIV population, anal Paps are a big deal.
Are they?
So it's an important way to look for abnormal cell growth.
Okay.
And usually done on the cervix. I'm also, like 99% of the time done on the cervix. But it's like doing a swab for strep.
Right.
Yeah, you could do it on anybody.
You're just collecting things to test and to look for those abnormal cells. Gotcha.
And so the test was developed by a Greek-American doctor and his wife, who was, as we'll find out in a minute, like really pivotal part of this. So
I always wondered if it was somebody's name.
It is. My Greek is rusty. So Georgios Papanikolaou is the name of the physician, of the researcher who was into it. And I really want to get his wife's name right, because she was his test subject. So she submitted to Pap smear almost every single day for like 30 years.
Oh my
God. He was developing it.
Oh, wow.
And I suspect that she wasn't just the person cleaning up the lab at the end of the day, that she was actually educated herself. She chose not to have children because she felt like that would slow down the research.
Wow.
And her concern is that at the time, I think cervical cancer was between the number one killer of women worldwide and the number 3 killer of women worldwide. So I've kind of seen.
So does she get any love for being a part of this? I mean, you make it sound like it was.
No, and I'm trying to find her name desperately, but again, I don't speak Greek. Here it is. Andromachi Papanikolaou. So she was married to him. She was, the most common test subject. I'm sure he did other women, but
if she opted to not have kids, she was more than just a test subject.
Right.
Is it? You think it's like an Einstein sort of situation going on?
Yes.
Okay.
Or Madame Curie kind of thing without the recognition. That's why I really wanted to talk about her. I didn't know any of this until I started looking into it, and I was kind of blown away.
Wow.
So there was also this is like science drama. There was a competing research group that was developing a similar but not quite exact same, and the Papanikolaou's one. So
when was this happening?
I think it was happening kind of like around and a little bit after World War II.
Okay.
But they were developing this for years. So Pap smears became kind of recommended screening medicine around in the 60s, probably closer to the 70s. And the aim is to detect potentially precancerous cells. So here's the deal with cervical cancer. It's not like the strep test, it's either there or it isn't. There's a gradation. And that's why it took so much time to research, looking at the finer details of how cells change over time. And this is actually a part of the body that can cure, air quotes, itself from abnormal cells.
Really?
So the body's immune system can, make this right again.
Huh.
Yeah.
That's interesting.
It's super interesting.
So I mean, was it the research was going in to clarify? It wasn't so much clarifying the process of a Pap smear as it was clarifying cell growth and precancerous cell growth, right?
Right, and I suppose you could, Pap like the inside of somebody's cheek and look how the cells change. And if, like I mentioned, there's other things you could Pap. You could Pap just about anything.
Right.
But what this development of this test did was that it decreased cervical cancer in the countries that use it as a screening tool. So now I would say in my career, I've probably seen, in 38 years, I've seen maybe 2 or 3 women with cervical cancer.
Wow, where it used to be one of the most deadly diseases for women. That's
Right.
not. Well, I'll be damned.
It's huge.
Just that screening, that knowledge opened that up.
Yeah.
Wow.
So most women PAPs start around age 20 to 25. It used to be younger.
Mm-hmm.
I have to say there was a criteria about how PAPs were recommended, and then there was a technologic change based on Papa Nikolaev's work, and then all of a sudden the screening that they have now is so improved that an otherwise healthy person, you don't have to screen them as often or as early.
Wow. Okay.
So
okay.
there's what came from this was an incredible understanding of how the cervix ripens after first intercourse in a young woman. And so it starts out looking really aberrant, but that's not an aberrancy that's going to result in terrible things. That's just a change and an adjustment, and then over time things normalize.
So you've lost me. What starts out looking aberrant?
So the cells from the cervix after sexual debut in a young female, so let's say a teenage female, they look like really horrific.
Oh, okay. So
They have a lot of shared characteristics, at least superficially, with the kind of cells that go on to become
So it might be kind of counterproductive to screen younger
women,
closer to
and
that.
so that's a big change. That's also something I wanted to emphasize, because there are younger women in this community whose aunties and mothers are telling
right.
them, okay, you know, and you must go in every year. But the screening has changed. When I started doing PAPs, at Planned Parenthood maybe 30 years ago, we would get the specimen, put it on a slide with something that looked like a butter knife. Okay, so it's like you're buttering toast, only buttering a glass slide, and then we sprayed it with hairspray
To fix it?
to fix it.
Right. That makes sense.
Yeah, but it was not optimal though. So for a
Your
pathologist,
test came up positive for Aquanet.
yeah, exactly. Oh my God! It was, when I think back, I thought, really, we did this for years. And the pathologist, so there's some guy sitting in the basement of some hospital somewhere reading slide after slide after slide, but it's basically at that point a pile of goo. So they're trying to sort out really delicate changes in cervical cells. And try and draw conclusions from that. And that's, a lot of women were treated for quote unquote cervical cancer who probably just had sampling error plus part of the normal maturation process that wasn't really understood very well.
Wow.
I know. And then I would say about 10 or 15 years ago, there was a really basic change that really made a world of difference, where so we would take the cells with something that kind of looks like a brush now, and then we would put them in a liquid and then kind of swirl it up and get a kind of an even layer of cells that are put on a slide, and then a machine looks at it. Sometimes a pathologist. They do have human beings reading the slides occasionally, but oftentimes it's kind of AI driven.
Right.
Which is super cool.
And that's one of those things that seems like a really good use for AI when you're having to look at something that is, a huge data set or just incredibly detailed.
Right.
That's why, yeah.
But then, because that sampling was so much better at finding abnormalities, something changed, and women don't really understand this. So with better technology in an otherwise healthy woman, you don't have to screen as often. And so women were getting the message, must get pap smear every year, and they all these little things like start the year with it, and then you don't have to think about it, or put it in your birthday month.
Pap smear for the new year.
Or,
oh my God, okay.
And this was, I think, kind of insidious. It was tied to refills of birth control pills, so you can't get your pills unless you come in for your pap, which at that time, unrecognized, was really wholly unnecessary to hold people's contraceptive method kind of hostage to a screening test that wasn't even necessary.
But why? What was the justification for that? That somehow the use of the pill, were they just trying to get you to have a regular PAP, or was there some sort of thought
It
that
was
the
a
use of the
carrot and a stick kind
Really?
of thing.
See,
Yeah.
wow.
And then Planned Parenthood saw that as a barrier to reproductive health.
Yeah, exactly.
And they separated it. But women were coming in faithfully, women in my generation, so I'm about 66. So I think women like 50 to 70 are just kind of trained to come in faithfully every year, even if they've had, by the time they stop getting PAPs, they've probably had like maybe 30 in their life, and all normal. That's like way overkill.
Right.
And so with the advent of this new technology, kind of a liquid-based, more even way of looking at things with AI to also lend a hand, really women who are otherwise normal only need to be screened every 3 to 5 years. And so the other thing that this new screening did was it gave us the ability to actually look at the genetic material of human papillomavirus. So human papillomavirus, aka HPV, is pretty much the cause of cervical cancer.
Wow.
Some women get alarmed if they have it in their family, but you can't really say, well, your mom picked a bad date that one night,
Yeah,
so, So it's really 100%, pretty much like 99.9% HPV related, with cigarette smoke or nicotine being also kind of an accelerant. So if people are not smokers, and if they're HPV negative, if their PAPs are normal, they really only need to get one every 5 years or so.
Okay.
Unless something changes, they develop a symptom that's worrisome or something like that. And I don't think women see it. That kind of unties that vague follow-up recommendation, 3 to 5 years, based on something the provider sees, but the patient might not really be in tune with. Kind of sounds like, oh, well, then I don't have to get PAPs anymore. Or has it been 5 years? No.
Yeah, right.
And so women are really not coming in to get them. And the group that's really faithful about getting them is kind of my age group, so 50 to 70, let's say. And they're the ones that don't really need them.
Right.
Yeah,
So,
it's really younger women.
So you're not seeing younger women coming in for regular Pap smears?
No,
Yeah,
hardly ever.
Huh.
It's not tied to their birth control. And they haven't been educated about the importance of it. And they just, who would be looking forward to that next Tuesday? You know what I mean?
Sure.
It kind of falls off your radar.
How is it treated, like in when you communicate with when healthcare providers communicate with patients? So there's this whole. So like I'm of the age where now like regular screenings for different things are a part of my life now.
Right.
Is any of that kind of outreach done in the context of Pap smears with women?
Not really, although it has been in the last couple of weeks. So part of the reason this was on my radar is there is a mobile PAP unit making the rounds around the different clinics in Humboldt and Del Norte County.
Wow, okay.
I think it was at Stellant most recently, but it was also at UIHS in Humboldt.
Who sent that out? Just California Public Health? Wow, okay.
I think it has something to do with partnership money, because partnership, they look at how healthcare maintenance is done, and because their goal is to eradicate cervical cancer, right?
Right.
And then if somebody's kind of not getting it done, then they do things like this to try and encourage people. On my acute care clinic on Saturday, I have my first 4 people that I see in the morning are hypothetically Pap smears, but who gets up at 8 o'clock in the morning on a Saturday to go get their Pap smear? And who doesn't show up is the younger women, and who does show up are women that are like over 65 that don't really even need it.
Right. Wow.
It's worth seeing that healthcare maintenance over the course of somebody's lifetime, the focus changes.
Yeah.
So younger women focus on Pap smears because cervical cancer or dysplasia, which is abnormal cell growth, is a thing. But women in my age group, it's more colon cancer and mammogram, breast cancer screening.
Is it just like postmenopausal? Does the risk just fall off?
Yeah, kind of. But if at that point, if somebody's a non-smoker and, let's say a postmenopausal woman might not be having a bunch of new partners and stuff, there just isn't the bang for the buck there, so to speak. Okay. So I don't think women know that. So the take-home message on this really is talk to your provider specifically about what your risk is and manage accordingly. There are apps for this. For cervical cancer screening. And what I would like to see is the provider sits and down with the patient, opens the app, and this is your risk. This is your personalized recommended screening.
Quick aside, is there like a catch-all app for all of that? Every kind of screening? Like, is there an app that could become like on your phone, like your personal healthcare reminding app?
There probably is, but I think you're implying that the patient can use or that the provider...
No, that the patient can use. Yeah. That the patient can educate and keep everybody educated as far as, hey, you should probably look into this. This is a new thing.
There should be, and I doubt there is.
Yeah, I know. That's really stupid for something, for a healthcare system that's so...
stupid.
Wow. Okay.
I like it because, let's say I'm doing a PAP on somebody, like recently I did, and I thought her cervix looked abnormal. I've seen lots of cervixes. And so I was able to get in the app and put all of her data in it. And there was a problem there, and it's being addressed right now.
Wow.
So, that doesn't come, that's a pretty rare thing. And if my spidey senses are tingling or something, I'm glad I had the tools to follow that up instead of just go to a higher level of care and say, well, I don't know.
Check this out.
It looks kind of bad,
Yeah.
So,
is there any detriment to having the yearly PAP?
Insurance won't pay for it.
Okay,
Which I think a lot of older women are kind of suspect about. They think these changes happened just because insurance woke up one morning and decided, I'm not
that's
PAP love.
I mean, but see, that's what I was thinking. Why don't you just lead with that, and then you could save all this healthcare advice and just go, here's what your insurance will pay for today, and we could just change the whole focus of the show. That happens
a horrifying amount of times, but not so much with this.
Okay.
There is,
what's a PAP smear cost?
$20 to $30,
right?
But up to $1,000 for the visit. Except, it involves a little bit of technical stuff. But
you've got to pay for the doctor's time.
$1,000 is way overkill.
Yeah, right.
But in the Affordable Care Act, screening for cancers, as long as the results are normal, is supposed to be free.
Okay.
And so there is also federal money, probably driven by research, that provides PAPs to people who maybe don't have insurance, aren't medical qualified.
So a couple of man questions.
Okay.
So is this analogous to, I found as well with other sorts of screenings and things that apply to me? Whereas in the past there were, in the very recent past there were strictures like this often at this age it begins, things like, and that those have changed.
They've become much more personalized, and so there isn't a really definitive thing. It's like, well, let's talk about your risk.
Is it basically because of the screening? Is it the same sort of analogous change with PAPs as with other things that test inside body cavities?
Yeah,
is just the screening so much better?
Because once insurance companies got a hold of the idea they didn't have to pay for PAPs every year, then maybe they looked at other stuff.
Yeah.
Yeah, so colonoscopies perhaps, or low-dose CT scans for smokers of a certain age group.
But I guess so. Yeah. Okay. It just separate from the capitalist question. Separate from is it technologically the advancement in the screenings and screening technology that has enabled these things?
Yeah, this is also data driven. I think that's what you're asking. Yeah, we didn't Papa Nicolau put a lot of thought. The couple put a lot of thought into their research, and it took decades. It was their life's work.
Yeah.
And then we kind of mindlessly, followed those recommendations probably for a couple of decades, maybe even 3 or 4 decades. And then all of a sudden, now we're looking at it for a really simple reason too. Let's just make this liquid, so the pathologist sitting in the basement somewhere isn't looking like at the stacked group of cells that he can't.
You're
really
just
see
homogenizing the sample, then,
exactly.
right? Yeah,
Exactly.
That's all it took,
it's
right?
It's like some of the best medical advances are just like so and then to truly understand what the process is, and it's not a train that's speeding to a washed out bridge, that we can slow that train down, and we can even reverse that train, and we can send the train back to the station.
You have here a note, and I don't remember addressing it, but it is an interesting question, and it's in the first person, so I'll read it like that. But I had a hysterectomy.
Yes.
And don't have a cervix any longer. Why should I care?
Well, it depends on why you had hysterectomy. If you had it because you had cervical cancer,
yes.
If the hypothetical you,
okay, right,
then you might want to get PAPs for a period of time, and you can do, like I said, you can PAP other things besides cervix.
But just to maintain, make sure you're in remission and have stayed that way. Sure, okay.
But then. Medicine went through this thing where they were doing hysterectomies and leaving cervixes.
Really?
Because there was a thought that doing a total hysterectomy and removing the cervix completely interfered with the woman's sexuality and her experience of orgasm.
Wow.
And so there's this weird kind of group of women for like 10 years that had their uteruses taken out but had their cervix intact.
Oh my gosh.
And it makes me crazy to try and they don't always necessarily have all the details of what happened to them. And so it kind of makes me crazy, like, is this the beginning of a uterus, or like what's the story?
Wow. Oh my gosh.
And sometimes you have to order imaging to clarify post-surgical anatomy. Yeah.
So I guess going back to my mail questions about the changing in testing and the frequency with which I'm contacted through the mail about things having to do very personal things in my body, has the Pap smear sort of fallen away a little bit now? Is it being neglected?
I don't think it's being neglected, but we understand that we don't have to use it in the same way that we used to.
Okay.
That we have a better version of it now.
It just seems like you say, like, younger, the women who should be having the Pap smears aren't, and I'm wondering if they're just not getting the same messaging.
Yeah, which is the reason I'm doing this show.
Oh, I guess so. That's why we're here today, isn't it? Yeah. It's another one of those doy moments.
Yeah.
Why doesn't anybody know about this? Something should be done.
So they either get the wrong message from well-meaning older women in their life, that's a much more kind of overutilized worldview, or it just completely falls off their radar and nobody's ever talked to them about it, and it's like, what again?
Right.
So, and a lot of women in Del Norte, I would say, compared to Humboldt County, don't necessarily aggressively contracept. They might use condoms and morning after pills, but not necessarily getting a prescription for, say, the NuvaRing. Like I know very few people up here that use NuvaRings, but the university set down there, they're all Nuva all the time. But
I have no idea what a NuvaRing
is.
Yeah.
It's a combined hormonal contraceptive that is a little ring that looks like kind of a jelly bracelet.
Okay.
And it goes into the vagina, stays in for 3 or 4 weeks, comes out, new one goes in.
Wow, okay.
And it's got about an efficacy of about 92% in usual use, which is consistent with birth control pills. And for a teen woman, you don't have to think about it all that often.
Right.
Maybe twice a month. Maybe.
Do many women still take pills? Still take the pill, I should say?
I think it's different in different populations. I do in teen clinic dispense a lot of pills. And I do, in the course of my regular practice, dispense a lot of pills. But birth control pills, the group of women who are using them are, a little bit older in Del Norte and have already had a child or two.
Right. Wow. Okay.
And the young women, it's, they, a lot of them are big into fate.
Into fate. Oh, no.
Whatever fate brings me. Which, we could have a couple of shows on that one.
Yeah, right. Yeah. The medical efficacy of fate and the changing attitude toward fate depending on your age too. When fate can be like the catch-all that saves you, or the thing you have to resign yourself to.
I think they're resigned to. I would argue, well, maybe this is not the time, but if we give our young people more dreams and more ways to have those, to work toward those dreams, then fate seems to be less important to them.
Yeah, interesting. Yeah, that's true.
It's more like action.
Yeah, exactly. How your action can affect that possibility.
So I do want to say a little bit about human papillomavirus, super common virus. If you think about it, being sexually transmissible is a really good way to move virus around the world.
That's what George Carlin said.
Yeah. It's also passed by skin-to-skin contact, so not always sexually. So I would say to the mother or father of the 9-year-old who's getting a well child check, and even let's say a young boy, why do I have to get HPV immunization for him? He's only 9 years old. Of course he's not sexually active.
Because it's like herpes. It's everywhere.
Yeah.
It's on everything.
Yeah. And it's actually, I've seen more HPV-related disease in young men in Del Norte who chew, oral and pharyngeal cancers.
Wow.
And so these young men lose their tongues. They lose their jaws. It's very disfiguring. Yeah. It's functionally like catastrophic because they can't talk anymore.
Wow.
And it's... they walk into acute care having no idea how sick they are and just saying, what's this? It's not like we get to go to the dentist as much as we should. Nobody really looks in mouths.
Yeah, that's
under
true.
Tongues, looks, around gum lines and stuff. And HPV in this community, because of pap smears, is not really as much a woman's disease anymore. It really is, here I would argue, at least equally a man's disease, maybe more.
Huh.
Yeah. And yet people can get an infection of HPV and it can clear itself after about 4 years. So our body has some wisdom here. But if we're being kind of not super smart and putting nicotine on that, we're taking away our body's wisdom and our body's ability to make things right.
Right.
There's different kinds of HPVs. Some strains are more likely to cause cancer than others, so that's something to remember. But some of the most common strains, and there's probably, 100, 200 strains, maybe more. But the most common strains are the ones that cause the most problems. So,
wow.
Pap smears in women have reduced cervical cancer deaths by 80%. Whoa.
That's amazing.
That's
amazing. No, you were talking about
we have very, very few successes in medicine that are that profound.
Right.
Super profound. And it's one of 2 immunizations that are cancer protective. So hepatitis B being the first one, because hepatitis B can contribute to liver cancer. And now HPV, head and neck cancers, cervical cancers, probably more that aren't really recognized.
Wow.
And the age limits, the thing to understand about age limits for immunization for HPV is they are arbitrary.
Really? Okay.
Insurance companies only pay for what the science tells us. And the science on the initial HPV immunizations looked at kids from 9 years old to 27. And so what if somebody is like 35?
Right.
At UHS, that community feels like immunization is important, and so it's possible to get HPV immunization paid for even if you're beyond the usual age limit. The age limits are not medical.
I'll be darned.
They're just financial.
They're actuary notes.
I know. It makes you kind of want to throw up a little bit.
A little bit.
So if you're over age 27...
We got chickens and fire trucks going by, all kinds of crazy things out there.
It's an exciting day here at the Fug House. But so the bottom line is, go get your annual exam. Pap smears are not, done by the right practitioner. They are not traumatic. They are certainly invasive. They're kind of embarrassing and uncomfortable. I'm waiting for the day that we have, like, some kind of scan, Star Trekian scan, and nobody has to take their clothes off, because that's really a vulnerable way to be if you're an 18-year-old girl.
Right.
So It's super important. Talk to your provider directly about your personal risks, and if you're contemplating immunizing your children, then you've already come to the conclusion the answer is yes.
Right.
So,
all right. Well, Lynn, thank you very much.
Functional medicine. It's a hot topic.
All right.
Yeah.
That's the next Health Matters.
Thanks.